I'm Candice Malcolm, and this is the Candice Malcolm Show. We have a great episode for you today, folks. We will be joined by Colin Craig from Second Street in just a minute. And this episode is brought to you by Unsmoke, our sponsor, but more on them later. So today we're going to focus in on the state of Canadian healthcare. We talk about it from time to time on the show, and it is worth repeating. I just, every time I see this headline, this story, it doesn't cease to amaze me. It is shocking. Nearly 75,000 Canadians have died on healthcare waiting lists since 2018. 75,000 Canadians have died since 2018. At least 15,474 Canadians died last year while waiting for healthcare. But the actual number is probably double, a new study shows. So according to secondstreet.org, when jurisdictions that provide no date are counted for, the actual number of Canadians who died is likely closer to 28,000. Folks, this is not normal. This is not okay. I know that Canadians take great pride in the fact that we have universal coverage for healthcare, that nobody goes uncovered and that nobody goes bankrupt trying to pay for their healthcare. But that doesn't make our healthcare system good, and it is not acceptable in an advanced, wealthy country like Canada for us to continue to place at or near the bottom of every ranking system on the OECD. I mean, look at these stories. Hundreds of people line up to get a family doctor in Kingston. You can see the image. This is from February 2024. Or again, back in January of 2025, hundreds of Canadians lined up in Brockton, Ontario, in hopes of securing a family doctor. So no, this is not a Soviet era breadline that I'm showing you. It's Canada's equivalent. It's the modern day equivalent. You got your Canadians out in the snow with their Timmies waiting for the chance to possibly have the privilege of talking to a doctor, talking to a family doctor. That is what things have come to today. And another story from the Fraser Institute show that Canadians are paying more for healthcare, but they're getting less. Canada's fewer doctors, hospital beds, and MRIs among longer wait times in other countries with universal healthcare. So even when you isolate for just other countries that have the same type of healthcare that we do, universal healthcare paid by the government, we are still the worst. Among 31 high-income universal healthcare countries, Canada ranks among the top third in spenders, but receives average to poor value in return. And so our friend today, Colin Craig, who's joining the episode, is trying to do something about this. He has released a new documentary where he compares Japan's universal healthcare system to Canada's. The documentary is released by secondstreet.org, and you should go check that out. So Colin Craig, he's a public policy advocate and president of secondstreet.org, where he focuses on issues related to healthcare challenges in Canada. Colin, welcome to the show. Thank you for joining us.
Well, thanks for having me, Candice.
Okay, well, tell us about this documentary that you have released. What was the purpose of it, and what did you find?
Yeah, so we went over to Japan to take a look at their universal healthcare system. It's a very respected universal healthcare system. So, you alluded to this earlier, Candice, but Canadians like having a universal system where everyone's covered. You're not going to get bankrupted if you need something serious, like maybe knee surgery or heart operation or whatever. So Japan does that. The big difference between them and us is that they provide treatment right away, and obviously that's not happening in Canada. We're literally dying on waiting lists for things like heart operations, cataract surgery, whatever. I mean, the stories in this country are awful. I think most people understand that. So we went over to Japan to kind of try and find out, what we could learn from their system. And the biggest difference between them and us is that it comes to the supply of healthcare. So in Japan, they take a totally different approach than Canada. They will welcome people to enter their healthcare sector and provide healthcare. You want to open up a knee clinic or a hospital or whatever, if you have qualified staff, you can do it in Japan. The government says, okay, everyone's covered in the country, and here's how much we pay for different procedures. So if it's a knee surgery, I don't know the number offhand, but I'll make one up. Let's say it's $10,000. And anyone who enters that market knows that, okay, the government's going to be providing $10,000 per knee surgery. So it's a very welcoming approach. They welcome people to help increase the supply of healthcare. In Canada, like I said, we do the opposite. We have governments putting up roadblocks anytime someone wants to start providing healthcare in this country. So by restricting supply of healthcare, go figure, you end up with long waiting lists like the ones that you just showed.
Well, one of the things that's so interesting from the documentary is that they just don't really seem to have real wait times in Japan. I'm going to play a short trailer from the documentary because you speak to a lot of people who work in hospitals, doctors, advocates, all this kind of thing. Most people say, average you wait like maybe a couple days or 2 weeks max when you need a surgery, which, to the Canadian ear, it's like, wait, what? How is that even possible? Well, you explore that. So let's play this clip from the documentary Fixing Canada's Healthcare Lessons from Japan.
We're in Japan this week to learn more about their universal healthcare system and how they have virtually no healthcare wait times. Come on, let's go find out.
The wait time is not very long. Basically, no wait time.
Do you have any wait times that are measured in years?
Not particularly.
How long waiting time while in Canada?
Sometimes a year?
Sometimes a year.
Yeah.
Year.
Yeah.
Really interesting stuff. You could see this sort of Japanese temperament, right? They're trying to be polite, but they're kind of shocked when you tell them about what things are like in Canada. And so, can you kind of unpack the reason? Like, why is it that there's so much innovation, there's so many options, there's so many choices in Japan, and yet they're still able to maintain that universal coverage, and people don't really pay that much out of pocket when they have major surgeries or even doctor visits?
Yeah, that last doctor in the clip there, he was asking how long the wait times are in Canada because he couldn't believe it when I said it was a year. Like they were shocked. People over there were like stunned that Canadians would have to wait so long. So to your question about how, the big difference is that in Japan, they welcome people to enter their healthcare sector and start providing care for patients. I mean, this is a novel concept, but they want people to enter if you have a qualified staff, obviously, but you can go in and open up a clinic that maybe does these surgeries, or maybe you open up a hospital. They openly welcome it because the government doesn't really care who's providing it as long as it's qualified people and that they can help patients. So the government sets the rate for how much they will pay for different procedures and that. And then everyone knows, okay, these are the terms of agreement. If I enter the market, then this is how much I'm going to get compensated for providing these different treatments for patients. So it's much easier. It's very straightforward. In Canada, we find the opposite. We have governments putting up stop signs, red lights, whatever, barricades, whatever you want to call it, to restrict the supply of healthcare. So Candice, tomorrow, if let's say you wanted to open up a knee surgical clinic somewhere in Canada and start doing like they do in Japan, where you would have staff providing knee operations to people, you can't really do that in Canada because you would have to come up with some agreement with the government where they kind of go, oh, okay, well, we're going to pay you X amount because our system just isn't set up that way. They fund services to patients. Our systems fund, or our governments fund health systems. So they throw money into the system and then hope that patients get a lot of treatment or healthcare services out of it. So a lot of our dollars get grinded down in bureaucracy just because of the structure is so different. So we restrict the supply. You end up with long waiting lists. And if you want to, let's say you don't want to wait in the public system in this country and you want to pay privately, well, government barriers are there to stop that from happening. You can't do that in your own province, with the exception of Quebec. So this is why patients travel to other provinces to pay for treatment. So we've got it all backwards, and lo and behold, that's why we have long wait times.
Well, 100%. It's like a big government top-down system where government controls everything. And if you try to innovate, like we saw with the day clinic in British Columbia, the Canby Day Clinic, the government will sue you out of
Yeah.
existence. So it's so much that it doesn't want competition so much so that it will put you out of business. The documentary is called Fixing Canada's Healthcare Lessons from Japan. I got a few more questions for you, Colin. First, I want to take a moment to thank the sponsor of today's episode, which is Unsmoke. Look, folks, it is time to modernize Canada's rules on nicotine. Alternatives to cigarettes like heated tobacco, vaping products, and oral smokeless products don't burn tobacco or produce smoke. They aren't risk-free, but the growing body of scientific evidence shows that they have the potential to be substantially less harmful than actually smoking cigarettes. Despite this, Canadians are banned from accessing critical information, and in some cases even banned from these products. Nicotine pouches remain banned in convenience stores, and current laws ban communication about the risks of these products compared to cigarettes. The evidence is here, tools exist. Canadians should have the freedom to know about them, to be able to learn about them. Please learn more by visiting unsmoke.ca. Okay, Colin, I want to ask you, because basically, we've been talking about this for a long time, that other alternative countries exist, right? We always compare ourselves to the Americans. We always look at the US healthcare system. It makes sense. We share a continent with them. We have similar sorts of populations. And yet, one of the things that you do over at Second Street is look outside of the continent for alternatives. So, we had this report that Switzerland has much better healthcare, other countries as well. Why hasn't this message gotten through? And even in Canadian provinces run by conservative governments like Ontario and Alberta, we haven't really seen a lot of innovation. Why do you think that is?
Yeah, it's a very good question because there's so many models we could learn from. So this year we just talked about it. We went to Japan. We also have a video on our site if anyone's interested where we look at Sweden's healthcare system as well as France's healthcare system. Europe in particular has a lot of better universal healthcare systems that are delivering better results. So there's a lot to learn from. To your question about why we're not seeing uh, reform happen fast enough in this country, um, the the problem as I see it, because we do a lot of public opinion research, the public is ready for reform. A lot of our polls show that people are ready for reform. They can see that the past few decades of throwing money at the healthcare system and hoping something would magically work, they can see that hasn't worked. We are one of the top spenders in the world, as you talked about earlier. We're not getting bang for our buck. So the public is ready for reform. The political class has been very slow to respond. And I think part of the problem is that a lot of people in the political class have long memories and they're still thinking that this is the debate from 20, 30 years ago, where healthcare reform was something that politicians just did not want to talk about because it was too controversial. But now the public understands that, there are better systems out there in Europe, countries like Japan, Australia, and others that we could be learning from and copying their policies. So the public understands that. I think that it's time for the political class to wake up a little bit. Something that was encouraging, though, and we do have these encouraging signs in different parts of the country. In British Columbia in their last election, one party there, the Conservatives, campaigned on a pretty bold platform to reform healthcare. So instead of, as political operatives will say, instead of a shield issue where they're kind of playing defense, they saw it as a sword where they could go out and aggressively campaign on it. Now, I think they could have communicated things better than that, but at least they were willing to kind of stick their neck out and start talking about it. In Ontario, some credit to the government there. They're starting to partner more with non-government providers for healthcare. This doesn't have to be, all the services don't have to be delivered by the government. The government can fund them, fund other people to deliver the services to the public, whether it's a nonprofit or for-profit entity. So Ontario's doing that more. I think that's a positive step. We'll have to see how well they've negotiated these contracts. Of course, you use different ways to do it better, but it looks like it could be promising. In Quebec and Alberta, Quebec's been doing this for a number of years, where they are funding services to patients. This is the fundamental difference I talked about before, where you kind of fund services to patients rather than funding systems. So Quebec is moving more towards paying for services to incentivize the system to make sure that we're focused on that. And Alberta has announced they are shifting in that direction to change how they fund healthcare so that more dollars reach services to patients rather than getting caught up in bureaucracy. So there's some changes. We do need to see a heck of a lot more. See that we can release patient suffering as harmful.
One of the things I learned from your documentary, Colin, is that in Japan, they have sort of three different types of hospitals that you can go to. You have the government-funded, government-operated hospitals. You also have nonprofit-run hospitals, and then you have privately run hospitals. And no matter where a patient chooses to go, basically the dollars follow the patient. So the subsidy goes wherever you choose, which creates the kind of competition that you would want in any market. And it creates more options because people have the choice to go to the hospital where they have the best experience. The overarching rules are that every single healthcare professional needs to be certified by the Japanese government. So it's not like they're just letting anyone go in and perform surgeries. You still have to have the same kind of medical license that you would have in Canada. This just seems like such common sense and such a wonderful way to manage a system. Do you see a possibility for anything like that ever happening in Canada?
Yes, I mean, it's a little bit similar to what I was just talking about, what Alberta's doing and Quebec, where the government if think about it, they've taken ideology out of healthcare because most patients don't care if you're getting surgery in a private, a nonprofit, or a government facility. You don't care if the nurse who's helping out with the surgery, if she's unionized or not. No one cares about any of that stuff. If you're a patient, you want the surgery done right. That's probably your top concern. You don't want to wait a long time for it either, right? So you want to get good service or fast amount of time. And when you're walking out of the surgical room or whatever, you don't want to face a big bill. I think these are the three things that Canadians are most concerned about. Now that's kind of how they approach it in Japan, right? It doesn't matter if it's a non-profit or for-profit. They'll fund, the money follows the patient. The patient decides which facility works best for them. So with Alberta shifting to this model where they are funding services, there's nothing stopping them from saying, well, yeah, you could get that service done in a private clinic or a non-profit or whatever. So we'll see how Alberta ultimately rolls things out. But it once you start to change how you're funding healthcare, it makes it a lot easier to start taking ideology out of healthcare and really putting patients right at the center of the system.
What a novel concept, taking politics and ideology out of healthcare. I wanted to show this graph from the Fraser Institute. It shows that the median healthcare wait time has hit 30 weeks, the longest ever recording time. So in 2024, physicians across Canada reported average wait times of 30 weeks between the referral from a GP to the receipt of treatment, up from 27 weeks. And so you can see from this graph, folks, how much things have grown. So the blue line shows 1993 wait times. Averages were much shorter. Actually, it's sort of more like what Colin experienced in Japan, that you can get a surgery done in a couple of weeks. Now it is nothing like that. So in a place like Prince Edward Island, you might wait as long as 77 weeks for a surgery. New Brunswick, 70 weeks. Even the fastest province, Ontario, you were still waiting on average 23.5 weeks. British Columbia, 29 weeks. Alberta, 40 weeks, 38 weeks. I mean, this is not good, folks. If you are in pain and suffering, you would want to see treatment a lot faster. Some good news, though, that I'll finish the interview on, Colin, which is that young Canadians have more support for changes and innovations in the system. Young Canadians support private healthcare. So according to a research company poll done in May of 2025, 36% of Canadians now believe that the healthcare system should be operated in the private sector. Nearly half disagree, but Canadians aged 18 to 34 had the highest rate, saying that they would approve of private healthcare. So what do you make of that?
Yeah, I think young people can see too the system is not working. And, like I said at the top, Candice, the good news is that Canadians like this idea of universality. And we can see that we can keep that. We can look to Sweden and Japan and France and all these other countries that have the universal system where everyone's covered and you can get treatment right away. I think that would appeal to you. But people are seeing that ideology in healthcare is not working. As we talked about Japan, people are getting in right away. People are not, they looked at me strange when I was over there when I was talking about people dying on waiting lists. Like, they cannot believe what is going on in this country. And there's one, I'll say this and then I'll finish, but this one medical director at a hospital in Osaka, we were talking and I was explaining like our system and the suffering and the government bans on access to healthcare, and kind of sat back in its chair and said, oh, I see why you came here. Like, it just kind of crystallized for him. But yeah, it doesn't have to be as bad as it's in this country.
Well, 100%, folks, go check out the documentary. It's called Fixing Canada's Healthcare Lessons from Japan. That is Colin Craig from Second Street. Thank you so much for joining us, Colin.
Thanks a lot, Candice. Always appreciate the conversation.
All right, folks, have a great afternoon. Back again tomorrow. Thank you so much. I'm Candice Malcolm. This is Candice Malcolm Show. Thank you, and God bless.